Feel any pain there?
No.
How about there?
No.
Okay, you are pretty numb then. So I had a patient come in to the office. She had this thick, really chronic thick nail that'd been there for years. And she ended up stubbing her toe against a piece of furniture and knocked that nail all the way up, and it started bleeding. So we decided to go ahead and, in the office, after numbing her up, take the nail off. So at this point, I give the patient two options. We could remove it temporarily and essentially wait for it to grow back. But as you can see, this was really thick. It had some fungus in it, but that layering effect that you see on that toenail, that's dystrophy. That's been damaged. You know, somehow in the past she related she had stubbed her toe and lost her nail multiple times. And so normally when a nail grows like that, it is been permanently damaged from the nail root, the nail bed. It can secondarily get a fungal infection, and this is where some people kind of feel like, I've tried all kind of fungal medications, but my toenail never comes back to normal. It's really because you probably have had damage to that nail. And so when we've got a damaged toenail like this, and especially after a traumatic injury like this, that where it got stubbed and it almost kind of came off, really the best option that I usually will recommend is removing it permanently. And when we remove it permanently, essentially, as you can see, we're removing it and adding a chemical to that nail bed, nail root, and we're cauterizing or chemically cauterizing or destroying that nail root tissue. What this allows is essentially the nail itself to not grow back, but the skin will eventually heal and get to a point where that nail bed is a little bit more of a hardened skin, and the patient never has to deal with a thickened toenail ever again, never has to deal with stubbing their toenail and lifting it up. And really it also prevents the nail from having to deal with fungus, which can secondarily get inside underneath the nail, within the nail, and the nail bed there. So the key is to make sure that we're applying enough time exposure to the phenol, which is why it's turning white, as you can see there. That whitish tissue is what is chemically being cauterized, and it's essentially causing a burn. So unlike any other wound, this is going to take about 3 weeks before it heals. And is simply because of the chemical that we're adding here. And again, this is the best way to do it. This is in the office. She's been numbed up. The downtime really is just that day and maybe tomorrow. Here I'm putting a little alcohol to stop the chemical reaction and dilute the phenol. I'm not worried about really any of the embedded blood at the very tip. All that will remodel as the skin and the tissues heal over the next 3 weeks. I do want to make sure that we put on a non-stick bandage, because when she takes this off tomorrow, it's going to stick unless we do this. Normally I'll tell the patient to go through a shower, let it get wet. As that bandage gets wet, she can remove it and then apply the wound dressing. Here we're using Amerigel, which is a great topical antibacterial wound dressing that allows for a much faster healing. And she'll have Tylenol or Advil to take for pain. Very rarely do I have to prescribe a narcotic pain medication. I do put a bulky gauze dressing on this to catch any drainage. And I'll see her back in a week just to make sure there's no infection, and then another 2 weeks from there at 3-week mark just to make sure everything's healed. And that is a permanent total nail avulsion. Very, very common with any of your foot specialists. That can be done in the office. I'd love to hear your comments. Make sure you click the subscribe button and click the little bell to get notified next time I upload a video. and I will see you next time.